Hi, my name is Michelle Yeiter. I'm a nursing student at Wilson State College, and this is my video for NG tube insertion. I'm going to bring scan the room. Okay, so right now I'm in checking my MAR against my provider's orders, and he has said that Shirley Coast, date of birth of 4/3/87, on today's date of 10/14/2020, is being admitted to med-surg for a small bowel obstruction. He has ordered she had an ultrasound of an abdomen at bedside and confirmed the bowel obstruction. He wants nursing to insert an NG tube for gastric decompression. He's ordered a Hurricane 1 spray by mouth before inserting the tube and a 2-view x-ray of the abdomen after insertion, and then to attach to low intermittent suction once placement is confirmed, and a strict input output. Okay, so it is 10 o'clock, so I'm going to look at now at my MAR, and then today for 10/14/2020, benzocaine Hurricane 1 spray for Shirley Coast 4/3/87, 10 o'clock, which it now is. Okay, so I have my hurricane spray here, and it's not expired, it's good to go for her, and I've done my triple checks on the benzocaine, or my double checks. I will do my third check at the bedside. So now we're going to go meet the patient. Oh, and I've gathered my supplies already too, and then I would go meet the patient. I've washed my hands, done my hand hygiene, so now we're going to go to the room. So, hello, hi Shirley. My name's Michelle, and I'm going to be your nurse today. Has the doctor come in and told you what's going on? He has? Okay. So you have a small bowel obstruction. He's told you about it? Okay. And so I need to insert a tube to relieve some gastric decompression, okay? Okay, so right now I'm going to verify your name and date of birth. Can you tell me your name and date of birth? Shirley Coast 4/3/87, okay. And that is what my MAR says. And now I'm going to look at your wristband. Okay, Shirley Coast 4/3/87, allergies to penicillin and furosemide, and that's what my MAR says also, and you won't be receiving those today, so you're okay with that. Okay, so right now I'm just going to listen to some bowel sounds, okay? Pull back your gown here. Okay, Shirley, yes, those are pretty hypoactive, which is what I was expecting. And so right now I'll go ahead and give you the spray. It takes about 10 minutes to work, and this is gonna numb your throat, so it doesn't you don't feel the tube so much, okay? Okay, so I'm gonna have you go ahead and open your mouth, and I'm gonna spray. Okay, so, and I've done my triple check. I would have done my triple check before I administered the medication. So now while that is working to numb, since it takes 10 minutes, I'm going to go ahead and I'm going to put gloves on, and we're going to measure the tube. Okay, Shirley. So I have my tube. And right now we're just going to measure. So I'm going to go from the tip of your nose to your earlobe, and then your earlobe to the xiphoid process. And I have about 51. So I'm going to take my tape and mark. There it is. Okay, there we go. Okay, so now I have that marked. I'm going to put this away. And now I'm going to just check your nose. See if I haven't seen any obstructions or anything. Okay, so no obstructions. Okay, and can I have you close each nostril one by one, this side, and take a deep breath? Okay, and then close this side and take a deep breath. And which one do you feel like you can breathe better out of? The right side? Okay, so that's the side that I'm going to use today, okay? And Shirley, do you have any history of facial trauma, nosebleeds, sinus infections, any of that? No? Okay, that's good. Okay, so now it's been about 10 minutes, so I'm going to go ahead and move forward with the procedure, okay? So I would change my gloves and perform my hand hygiene and put new gloves on. And so now I'm just going to do a little bit of prepping here. I'll open up my supply here. Okay. Okay. So I'm going to take my lube. First I'm going to attach my, so I'm going to lay things down here. The stomach is not a sterile field, so I don't have to do sterile technique. I'm just going to get my stuff ready here. Okay, so I'm going to go ahead and spray. Okay, Shirley, before we get started, if at any point you need me to stop, I want you to use your left hand and put your hand up to stop, okay? And then also, I want you to, if everything's okay, just remain as calm and still as possible, okay? It's going to be a little bit uncomfortable, but it doesn't take too long to get through. So I'm just going to go ahead and prep the area a little bit more, give you a little Emerson basin, and my water here. This is some nice cold water, okay? Okay. So at the count of, I'm going to have the bed up in the high Fowler's position, and I'm going to have you look to the ceiling to hyperextend your neck, okay, while we start, okay? Okay, so 1, 2, 3, look up to the ceiling, okay? Okay. So I'm going to go in and I'm going to meet some resistance. So I'm going to turn my tube and I'm going to go a little bit farther. Okay, Shirley, I see you've told me to stop. So I'm going to pull back a little bit, about 1/8 of an inch. Okay, Shirley. So to keep moving on, I know that you were gagging a little bit there. I just want you to drink some of this cold water. And as you take a small sips, I'm going to keep advancing, okay? And I just need you to take sips and sips, okay? Okay, ready? Swallow, 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 swallow. Okay, swallow, swallow, and then we've met our tape. So I'm going to take my pen light and my tongue depressor. I'm going to have you hold that there, Shirley, okay? I'm just going to check. Okay, it's not coiled in the back of your throat, so that's good. And I do see some gastric contents coming out. So I know that this is my spot, okay, Shirley? So right now, I'm going to have you still hold the tube. I'm going to clean your nose and stick this to your nose, okay? Okay. And then I'm going to mark it with a marker. Okay. Yeah. Okay. So Right now, I'm gonna take this off here and I'm gonna aspirate a little bit of stomach contents to make sure we're in the stomach, okay? So I'm just gonna pull back a little bit. Okay, I got a little bit there. So I'm gonna go ahead and pull out and plug. I'm just gonna have that up there. Go ahead and squirt this into my cup. Okay, take my litmus paper, test, and compare it to my scale, and we are at a 2, so that's perfect. That's right where we want it. So at this moment, I'm gonna call X-ray and have them come and do an X-ray of your chest just to make sure that we are in the right spot. So while we're waiting for X-ray, I'm gonna go ahead and measure our spot here. So, there we go, centimeters. Oops. My green line. Down to the base, so I have, I'm going to say 61 centimeters, okay? So I would document 61 centimeters, which I'm just going to write down right there, okay. Okay, Shirley, so we've documented that, and I would document your gastric contents on the color and the acidic level and all that too, also in your MAR. So, okay, so right now, since X-ray has come back and everything's in the right spot, so we can go ahead and attach this, oh, I don't see my reflex bulb. I have a reflex bulb. I'm going to attach the reflex bulb, and then I'm going to attach this to low intermittent suction, okay? And I would check back in 4 hours. I'm going to clean up my mess. Okay, so it's been 4 hours, and the doctor's orders have come in for Shirley to have some Ativan. So now I'm going to go back to the med room, and I am going to come back over here to the med room and compare my provider's orders again with my MAR. So I have 1,400 hours, Ativan 2 milligram tab per NG tube for anxiety for Shirley Coast, date of birth 4/3/87. And my MAR says Ativan 2 milligram as needed for anxiety for 10/14 at 1,400 hours for Shirley Coast 4/3/87. So I've done my double checks in here. Here's my Ativan. I would crush this, put it in the cap, and add some water. I would also put 60 mils of water in this cup to flush before and after the med is given. So, so now we're going to go back to Shirley's room. So I would have changed my gloves after the procedure and done hand hygiene, and now I'm going to re-enter the room. Hi Shirley, it's me again. How are you feeling? Not too good? Okay. So I see the doctor ordered you some Ativan. Did he tell you about he was going to give you some medication? He did? Okay. So this will help calm your anxiety a little bit. I know it's a little bit scary and unnerving to have that in your nose, okay? So I've already done my triple check with the medication, and so we are going to go ahead and administer the medication. So it's already crushed with water in my med cup. So, okay, so right now I'm just gonna measure my tube again and check for placement and make sure nothing has moved, okay, Shirley? Okay. Okay, 61, that's what I had before, so perfect. And I need to aspirate a little bit of stomach contents just to make sure we're still in the stomach, okay? So I'm going to go ahead and pull this out, aspirate some stomach contents. Okay, I got a little bit there. And put that in. Okay. Check with my litmus paper. Okay. Compared it to my scale and we're still at a 2, so we are still right where we need to be. Okay, Shirley? So I've put new gloves on for this procedure and I'm going to go ahead and get ready for your med. Okay? So I'm going to go ahead and pull out 30 milliliters of water. Okay, I got my 30 mils, and I'm going to go ahead and crimp your tube, and we're going to go ahead and put the 30, oops, sorry, didn't have that in right. There we go. Now 30. Okay, I'm going to go ahead and crimp your tube. And pull my stopper, put it back in, add my medicine, let it drain. Okay, it's in. I'm going to crimp my tube. And at this point, I'm just going to plug it so I can put my stopper back in and pull up my 30 mils of water. Okay, so I got my 30 mils. So I'm going to go ahead and crimp, pull out, attach, and push 30. Okay, Shirley. So, how do you feel? Do you feel okay? I've attached this back to the intermittent suction. I'm going to go ahead and just listen to your bowel sounds again. Okay. Still pretty hypoactive. Okay. So I would document on my MAR that I gave this medication. And I would return in a little bit, make sure she has her chart. Again, clean up my mess and await orders. So, okay, so now it's 5 o'clock and the doctor has ordered the tube to be removed. So I'm going to go back to the room and I would have removed these gloves and washed hands. So hello, Shirley. I have good news, and I'm sure you've already heard that you get to have the tube removed. Yes, isn't that wonderful? I know. So, right now I'm just gonna get everything ready. But the doctor's come in and asked and told you how this is all gonna go, right? That we're gonna remove it, and you're gonna be good to go. Okay. So, I'm gonna put on clean gloves for this procedure, and I'm going to go ahead and prep everything and get ready for the removal. Okay, so I'm going to go ahead and cover you up here, and I need alcohol wipe, and I'm going to loosen up the glove here, loosen up the sticky nose pad. Okay, and so I got that loosened. I've already unhooked it to the suction, and I'm gonna have it sit down here. Okay, Shirley, I'm gonna have you take a big deep breath and hold it as I'm pulling out. Okay, okay. So on the count of 3, we're gonna go ahead and pull out, okay? 1, 2, 3. Okay, we got it. How are you doing? You need a tissue. Wipe your nose. Okay, you're doing good. I bet. Let me listen to your bowel sounds. Okay, they sound a lot better than they did earlier, so you're doing better. Okay, so is there anything else I can get for you, Shirley? I have your call light here next to you. You're feeling better? Okay, so I'm gonna go ahead and chart everything I've done. Shirley has her call light. She doesn't need anything. I would remove my gloves, perform hand hygiene, and chart everything. Okay, thank you.